Healthcare is adapting to suit the changing needs and expectations of patients, carers, the community and clinicians. New South Wales must meet the challenges of planning, funding, delivery and evaluation of services that are posed by an increased demand, an ageing population, and rising chronic disease and the impacts of new technology. This means that it is important to identify initiatives that create better value healthcare, optimising the use of health resources while improving outcomes and the safety and quality of patient care. The New South Wales health system is evolving from measuring volume in terms of activity and outputs to measuring value to patients in terms of their health outcomes and experience of care. Patient-reported measures capture what matters to a patient in their life. It enables patients to provide direct, timely feedback to their healthcare professionals about outcomes and experiences that are important to them. It also enables a consistent and structured method to capture and use patient-reported outcomes and experiences in real time. This information will also support services to identify opportunities to improve outcomes over time. Patient-reported measures can be broken into two groups: patient-reported outcome measures and patient-reported experience measures. Patient-reported outcome measures capture the patient's perspectives about how their illness and care impacts on their physical, mental, or emotional health and well-being. Patient-reported outcome measure surveys are collected regularly, usually before or during a patient's appointment or visit with their healthcare provider, service, or hospital. The questions help to identify what matters most to a patient and how their care, treatment, or symptoms are affecting them. The answers help the healthcare provider or service to have a conversation with their patient about the important things in their life, such as the impact pain may have on things they enjoy, like socialising and being active. Because the surveys are completed over time, they help to identify if the care or treatment is making a difference. Patients also like to see and keep track of their progress, as often it can be difficult to recall how they were feeling 12 months ago. Patient-reported experience measures gauge the patient's experience and satisfaction with their healthcare. They are surveys that are completed anonymously by patients to capture honest feedback about their experience with healthcare services. Patients cannot be identified by the information they provide to their individual provider. Patient-reported experience measures are typically collected at the end of the service or program, or at regular intervals for longer-term services, to allow patients to reflect on their overall experiences. Together, patient-reported outcome measures and patient-reported experience measures will help us deliver value-based healthcare centred on what matters most to patients.